Hi, I'm Dr. Rich. I'm a general dentist with over 25 years of experience, and I'm teaching you about dentistry and teeth so that you can have a very nice smile. So in this video, I'm going to explain why snap-in dentures are actually going to work better for you in your lower jaw than a traditional regular lower denture. So let me first start off explaining what a snap-in denture is. I've made some videos on it that I'm going to leave links to up here on the card and also down in the description. But basically, a snap-in denture involves having some dental implants in your jaw. For a lower, usually I recommend at least 2 implants, kind of where the canines are. 4 would be better, but 2 will work. And then on top of the implants go these little posts, which correspond with some plastic snaps that get incorporated in the denture. So when you put the denture in, press it down, it snaps into place and it doesn't move. And you can chew much better with it than you can with a conventional regular denture, especially on the bottom. And you can enjoy the foods that you used to love when you had your own regular teeth. So how is a snap-in denture different from a regular denture? Visually, if you look at them, it doesn't really look that much different compared to a regular denture. The 2 main differences is because it's going to be snapping on and in and out onto the implant posts, I like to incorporate a metal framework into the denture, into the body of the denture, into the plastic, just to give it some strength so that the fact that it stays in place better and doesn't move around as much, people actually can chew and bite much harder with it than they can with a regular denture. So that metal framework in there gives it extra strength to help prevent it from breaking. And then also, if you look on the inside of it, the part that sits on towards the gum, that's where you will see the snaps. Usually they're either all plastic, or in some cases there'd be a little metal cup with the plastic insert in the cup. And that plastic insert is what snaps onto the posts. But if you were just to look at them from the outside, the average person couldn't tell the difference between a snap-in denture versus a regular denture. In fact, if I have a patient that comes in who has an existing lower denture, while I'm making the new snap-in denture for them, I'll retrofit their old denture just to so they get an idea as to how it's going to feel. And I tell them to hold that as a spare, not to use it all the time, just because it's now with the implant, it's going to be weaker and there's no metal framework in it. All right, so why is a snap-in denture better on the bottom than a regular denture? Well, first off, let's back up and discuss why a lower denture does not work as well as a traditional upper denture. So an upper denture, when that's made, if you look at it, it looks like a suction cup. It's designed and it's made to cover the roof of your mouth and seal all the way around the edges, so that when you place it in your mouth and press it into place with your thumbs, you get a suction cup effect and it stays in. It actually stays in pretty well for majority of the people. In fact, a lot of times people will come in with a upper and lower dentures and after discussing it, they're perfectly happy with their upper traditional regular denture, and it's just the lower that they're having issues with. So we'll just make a lower snap-in and we'll leave the upper, and they're able to chew very well with that situation. Lower dentures, because of their shape, they don't have as much surface area. They're horseshoe shaped rather than suction cup shaped. So you put them in and you don't get very much suction. And then also, your lower jaw is the jaw that moves. If you think about it, move your jaw, it's the lower one. Upper jaw stays in place, it doesn't move around. So now you have your jaw that's moving and the denture has to move with it. And then also your tongue is right there. And so your tongue always wants to press against the denture, kind of pushing it out. Your lips are trying to push the denture in, hold it in place. There's a lot going on, and without a lot of surface area to hold it in place, it tends to move around. Also, just because of that, there's less surface area. A lot of people too who had lost, say it's been several years since they lost their teeth, especially in the back. The jawbone's very short and there's not much for it to grab onto, and it tends to move around a lot. So how many implants do you need for your lower snap-in denture? Well, the minimum is 2 dental implants, one in the area of each canine, basically, kind of towards the front, 4 would be ideal because you can have those 2 towards the front and then another 2 further back. That'll spread the forces out and it'll lock it in place even better. I've had situations where the fit was so good onto 4 implants for people that I couldn't even put conventional snaps in all 4 of them because the patient had trouble removing them. I ended up having to just use 2 of them as snaps, and then 2 of them I just put 0 retention snaps. So they're snaps, they snap in, but they don't actually give any hold. But that way the person was able to remove the denture. So what are the downsides, though, to only doing 2 versus the 4? Well, so the 4, if you think about it, it's kind of like a table leg. It's a table. That's got 4 legs. It's got nice even support all around to help hold that denture in. So you bite something on the front, the snaps in the back are going to keep it from popping forward. You bite in the back, the snaps in the front are going to keep it from teeter-tottering up. If you only do the 2 dentures, what can happen for some people is the front will stay in very well, but sometimes the back end of it, because there's no implants to help hold it in place, will want to kind of pop up and down, move up and down. So again, it depends. When we design it, we try to avoid that as much as possible, but for some people that can happen, so it's going to vary from a case-to-case basis, but that's usually the downside to only going with 2 versus going with 4 implants. Okay, so what's involved in making a snap-in denture? Well, the actual making the denture part is very similar to making your conventional regular denture. If you're interested in seeing what that looks like, I'll leave a link to a series of videos I did where I made a full upper denture and lower partial denture, and I'll leave it up here and down in the description as well. But in addition to the denture, you're also going to need at least 2 dental implants, 1 in each side, then the 2 posts, and then the snaps that get embedded into the denture that help attach it to the implants. So initial cost-wise, it is going to be more expensive than a regular conventional denture. Again, I made a video discussing hypothetical costs. I'll leave a link to that up on the card and down in the description. But basically, in addition to the cost so you got to figure in the bare minimum cost of 2 dental implants, 1 in where each canine is, cost of 2 posts on those implants, and then the cost of the overdenture itself. The overdenture in my office is more expensive than a regular denture because it includes the metal framework that gets incorporated into the body of the denture, and it also includes the cost of attaching the overdenture onto, adding the snaps inside it, making any adjustments. What I'll do in the beginning too, I always start people off with the lightest strength snaps, see how it goes. We might need to swap out strengths and to get the best fit and the best retention for people. Okay, next let's talk about maintenance and costs associated with maintenance. So a conventional denture will over time wear, the teeth will wear because the teeth are acrylic, and that's the same thing with the snap-in denture. The teeth will wear over time, and then as well, over time your jaws will continue to shrink, and so a conventional denture needs to be relined, possibly every few years, and then most people can benefit from getting a new denture every 7-8 years or so, just as their jaw changes. So those same things can happen with the snap-in denture, although you're not going to get actually any bone loss where the implants are, because the implants are going to help keep the bone there. But where the implants aren't, you will still get bone loss. So it's important to have that checked, make sure it's fitting properly, because you want the snap-in denture to rest on the gums. You don't want it to be held up on the implants because it's not designed to withstand that. And if you go too long without getting it relined or making sure that it doesn't need a reline, you run the risk of it sitting on those 2 implants, and then those end up being 2 spots or 4 spots where it can more likely to crack because of the stress, the actual pin, the pressure gets focused on those areas. In addition to relining it from time to time, the plastic snaps, the inserts, will wear sometimes, and there's a cost associated with replacing them. If it's just the snap wearing for one reason or another, that's usually a simple a less expensive fix. We just take out the old snap, put the new one in. Sometimes though, the snap will come loose. Won't be embedded in the denture anymore, or if it needs to be relined, it needs to be re-embedded into the denture, and that'll be an increased cost because got to use some acrylic to lock it into the right position again. And then lastly, with the implants, I recommend people see their dentist at least once a year to get the implants cleaned, get everything checked out, make sure you're not getting any gum disease around those implants. Because dental implants, because they're made out of titanium and metal, there's no way you can get a cavity on them, but you can still get gum disease around them. So if you're not keeping them clean, you can lose an implant, and then once you lose an implant, you got to get a new one in. You're basically starting over from scratch. And also at that visit too, that's when I like to evaluate the fit, make sure that the denture is still resting on the gums, not on the implant. And I also check the implant post, make sure that they're not being worn down, especially with the type of inserts that have a little metal cap inside. If you wear them long enough that you wear through the plastic insert and it's metal against metal, something starts to wear. So on the implant post, they're usually a gold color. So if you look at them close and you can see some silver metal shining through, that means that they're wearing and they most likely need to be replaced with new posts. So how long do they last? Typically a denture needs to be replaced 7 to 8 years, 10 years. I mean, I've had outlier patients who've had them same set for 20 years. So it depends on the person. And the same thing is true with the snap-in dentures. Generally though, the denture will wear. The implant itself, as long as you keep it clean and healthy, there's a good chance it's going to last you for the rest of your life. As long as it doesn't get infected, as long as it doesn't get any gum disease, what's called gum disease around an implant is called peri-implantitis, inflammation around the implant basically. And then the snaps do need to be replaced since they are plastic. So think of that as getting a new set of tires on your car every so often. So on your snap-in denture, you will need new inserts from time to time. How often they need to be replaced depends on how parallel they are, the two implants. If they're straight up and down relative to each other, they'll tend to not wear the snaps as much and they'll last longer. If one implant is angled compared to the other, it's going to wear quicker. They're both going to wear quicker and you'll need to have them replaced sooner. Lastly, do you absolutely need a snap-in? No, of course you don't. I have lots of patients that have a conventional regular denture and they're doing fine with it. They're able to eat what they want to eat. They can chew what they want to chew. Granted, they're not going to be able to chew as well as they did when they had their own natural teeth, but they're happy. They're able to function with it. So it all depends from person to person. And now what if you have a lower denture or you're going to get a lower denture and you don't want to get a snap-in denture, you don't want to deal with implants. So a big thing I usually recommend to people is especially if they already have some teeth and they're going to have the teeth pulled and have either an immediate denture made or they're going to have the teeth pulled, wait a few months, then have the final denture made, is when you have the teeth pulled, talk to your dentist, oral surgeon to make sure they're not too aggressive with the aveloplasty. Aveloplasty is once the teeth are pulled, they trim down the jawbone to make it easier for the dentures to fit in. The problem is if you trim it down too much, then there's not going to be much for the denture to hold on to. So if you're not going to have implants helping you out, you need the jawbone. And so you want to have that jawbone as kind of straight up and down as you can. Maybe have them take a little bit off to avoid any undercuts, to decrease the amount of sore spots. But when I do immediate dentures, I tend not to do any aveloplasty. I just take the teeth out, put the denture in, and just kind of let it heal on its own. There'll be more sore spots in the beginning, but I feel later on, as it's all healed, people will the denture will stay in better because they have more bone to hold on to the denture. So I hope you found this video interesting. If you did, I'd really appreciate having you subscribe to my channel if you haven't already. Click at the thumbs up button too. That's always very helpful. Any questions or comments, please leave them below and I'll try to answer any questions that you have. Thank you guys so much for watching. See you in the next video.